Hi, I'm Tim Williams of Dwyer Williams Potter, Injury Accident Attorneys. Sometimes when people are involved in an accident and they hurt their shoulder, they're diagnosed with a condition called bursitis. Well, what is bursitis? Well, essentially, bursitis is an inflammatory process due to trauma. What is that? Well, I'll show you. Here we have a model of the shoulder. This is your collarbone. This right here is your shoulder blade. This is your arm bone where it comes up and connects to your shoulder. And if you turn this sideways, we're now looking at the outside of the shoulder. Your neck could be right here, and your rib cage would be up here in front of the shoulder blade area. So under here, you'll see there's a little space underneath the bones and this other connective tissue and the muscles underneath. And in that little space, to prevent friction, there's what are called bursa, or bursal sacs. A bursal sac is essentially like a small water bed, if you think of it that way. So there's an outer layer filled with a gooey lubricant inside, and the idea is to lubricate and prevent pinching and grinding from the bone, between the bone and the underlying structures, such as the tendons and the muscles as we see. Well, if you have an impact to the outside of the shoulder, either from the front, which would be here, the outside, or even the back, it can cause those bursal sacs to become pinched. When they become pinched, they become inflamed and painful. And what happens when they become inflamed and painful is they want to expand due to the inflammation, and that creates more pain. And the body responds by increasing the fluids to the area, which increases the inflammation and becomes more pinched. And so it's a cycle that occurs where the pain causes inflammation, which causes more pain, which in turn causes more inflammation. So let's say you're involved in an accident and you have the bursitis, the painful shoulder. Well, how do the doctors treat that? They do it a number of different ways. First, they try rest, ice, and heat. The idea there is if you rest the shoulder area, it's going to reduce the friction, reduce the pain, and the swelling will go down. If that doesn't work, generally they next try medications, anti-inflammatories. They may inject it like they did with me about 4 years ago, and that helped readily. Or ultimately they may go in and do what's called a bursectomy, where they actually go in, cut the bursitis out, the bursal sac out. Now, it sounds scary. Ultimately, it tends to grow back within a matter of weeks to months. But they cut it out, and when it grows back the normal size under ideal conditions and not as inflamed. Now, insurance companies like these cases because, not that most people have bursitis before the accident that causes them injury, but the insurance carriers like to say, well, it's not a bad injury. So you have some shoulder pain, it's not worth a whole lot, you don't really need the surgery, just take some medicine and cowboy up, as they say. Well, that's where an injury attorney such as myself and my firm become handy.